I am Dr. Dorothy Becker. I am the Division Chief of Pediatric Endocrinology and Diabetes at Children's Hospital and the University of Pittsburgh. My research is directed towards the prevention of type 1 diabetes and its complications, and I have been involved in this research for the past 36 years. Family members of individuals with type 1 diabetes very often ask their pediatricians about screening themselves or other family members for the risk for development of type 1 diabetes. The best way of screening for the risk of type 1 diabetes is not the measurement of blood sugars, either fasting or postprandial. Instead, the best way is the measurement of autoantibodies against antigens of the islet cells that make insulin, using very specific, standardized research methodology. The question is, why screen? There are two major reasons. The first is the availability of prevention trials to try to prevent or delay the development of type 1 diabetes in at-risk individuals. The second reason to screen is that it has been shown that individuals who participate in research trials are likely to have their diabetes detected earlier because of regular in-depth surveillance with antibody and glucose tolerance testing. And these individuals are therefore less sick with less risk of DKA at diagnosis. The advantage of this is that they then have significant residual amounts of insulin secretion and insulin secretory cells that can be preserved to a certain extent with tight diabetes control. There are currently 2 ongoing trials around the country. The first is vaccination using oral insulin, that is insulin tablets by mouth, in individuals who have high levels or high titers of insulin autoantibodies. These individuals tend to be the youngest members of the family, which is why we screen children over the age of 1 year. The second is for family members who have progressed to abnormal blood sugar levels detected during oral glucose tolerance testing, and these individuals are eligible for an immunosuppressive therapy using anti-CD3. The advantage of preserving insulin secretion is not that insulin injections can be stopped, but diabetes is easier to control, and preserved secretion has been shown to decrease the risk of later complications as well as hypoglycemia. At this time, Type1Diabetes TrialNet, an international consortium supported by an NIH grant, is screening first-degree relatives under the age of 45 and second-degree relatives under the age of 20. Thank you for watching this clip, and I hope that you will remember to refer your patients who have a relative with type 1 diabetes. For more information regarding this trial, look at the link for Diabetes TrialNet at the end of this video, or call the contact number for the research nurse Karen Riley.